I'm Dr. Roberta Evans, and I'm here to present to you an introduction on trauma-informed practice with adolescents. I'm currently Associate Director with Achieving for Children, and my doctorate is in youth justice, and I'm a qualified social worker. And I have a keen interest in contextual safeguarding, youth justice, and working with adolescents. So I hope that this presentation is helpful for you and your practice. So if we're talking about trauma and adolescence, the first step is to understand child development. And as a summary, child development is seen in stages and through ages. And the theories of development have informed our education system and when children should transition. So the stages will often follow through the nursery to primary, infant, primary, adolescent, secondary school, and so on. And while physical development is fixed and also some cognitive development, emotional and social development can be revisited. And this is really important when we're thinking about our work with children and adolescents, because through those periods of transition, as they're developing physically and cognitively, their emotional development and their social development, whilst being experienced through those stages, can be revisited, and it can be revisited with adults as well. So if we think about working with parents where there's trauma, we can revisit that. And relationships will impact these developments significantly. So I'm going to focus on emotional development because that's where trauma will be sitting and where we need to think about our practice. So if we look at emotional development and in the stages, and this comes from Giles Barrow and Pamela Levin, and their work around transactional analysis and how our relationships and our transactions will influence the way that someone could revisit those emotional stages. So I'm going to first look at the different stages from newborn. So a little newborn baby from 0 to 6 months, they need to have a sense of trust. And all of us need this. We all need to know that we're wanted and our needs will be met. And this is absolutely crucial within the newborn stage. And the things that we all need to hear is that we're glad you are you and we want you. Now, if this need hasn't been met, what we'll see with older children, adolescents, and adults is that they have no sense of belonging. They're unsure about their feelings, and they'll display attention needing behavior. So you'll possibly see a child always calling out in class, or you'll have a young person who's described as attention needing, and that's because they don't have a sense of trust. And you'll even have that with adults. And any of us may experience this sense of needing trust in any transition. So transitioning into a new job, for example, it's really important that you feel like you're wanted and that that's where you belong. The next stage of emotional development is first presented with the crawler. So that's from 6 to 18 months. And the little baby then starts to need a safe space to explore. And what they need to hear is that it's okay to be active and explore. And that's what we all need emotionally as well, is that once we know that we have a safe place and that we have a sense of trust, next we need to know that we can start to be a little bit active and start exploring new ideas. If this isn't met when someone's older, you'll see that they've got difficulty staying still, a lack of concentration, high risk-taking behaviours, and also going into prohibited areas. So for young people that we might be working with in the youth justice system, you will often be working with someone with these presenting behaviours, and you could then think about, okay, they're acting actually as emotionally as someone in the 6 to 18 month stage, and what they need is a safe place in which to explore, and they need to hear that it's okay to be active and to explore. So they're wanted and it's okay to be active. The next stage is first presented in the 18 months to 3 years. Now, most of us will know that this is often called the the tantrum stage. But actually, this is a really important emotional development process, because the toddler needs to start understanding that they've got a sense of personal control, and they need to know it's okay to think for themselves. And if they're older and they haven't had this sense of being able to have choice or personal control over their situation, you'll see tantrums, boundary testing, and non-compliance. And you could see that in an adult as well. If they've not had that sense of being able to think for themselves, and they've had really authoritarian parenting or really strict environments, then you'll start to see tantrums. But maybe that's through self-sabotage rather than a tantrum of a 3-year-old. And then the next emotional stage, which is usually presented in the nursery age of 3 to 5 years, is when there needs to be a sense of purpose. So if you imagine nursery age child going into school, they're starting to see themselves in comparison to their peers, and they're also starting to question sort of what life is like. This is common to start hearing about the types of jobs that they might like to do when they're older. And what they need to hear is that all your feelings are okay here. And if this isn't met when older, you'll see lying, manipulation, and difficulties with identity. So it may be that someone's got their sense of trust, and they know that they're wanted, they've had space to explore, and they also have had space to push boundaries and think for themselves and make choices, but then they don't have a sense of purpose, or their feelings are not being acknowledged. And that's where you might start to see some lying and manipulation, because they're struggling with the world. Then we have primary age. So this is a time when children are learning about what they're good at, and they really need a sense of competence, and they also need to know it's okay to make mistakes. And it's really important for them to see that as they're learning new skills, that by making mistakes, they are learning. Now, if this hasn't been able to be met, if they've not had a sense of competence, or they've not understood that mistakes is a process of learning, then we'll start to see a fear of trying, difficulties in peer groups, and they'll debate the fairness of rules. And then finally, for adolescents, which is usually presented from over the age of 12, it can be younger, there is some fluidity here, but emotionally, this is a time where children are starting to transition from childhood into adulthood, and they really need a sense of self and identity in this place. And they need to know it's okay to grow up. And if they're forever pushed down, I suppose, into still being a child, then they will present with blaming others and being unwilling to be independent. So that's the emotional development stages, and linked to transactional analysis theory. And then that links in with brain development. And sorry, I'm getting little clicks from notifications, so just I'll ignore those as well. So brain development could be seen as like a building where interactions, experiences, rewards, validation, and responses all build the blocks of foundations. And I've got a video to show you in a moment around brain development and how that links with emotional development. And the key changes to the brain occur between 0 to 5 and then 12 plus. That's when the brain is more sensitive, and a lot of changes are happening in the wiring of the brain. And I've got a quote here from Shonkoff et al., and there's a link to the references at the end of this presentation, where relationships are absolutely key to brain development. I'm just going to read this quote directly. Healthy development depends on the quality and reliability of a young child's relationships with the important people in his or her life, both within and outside the family. Even the development of a child's brain architecture depends on the establishment of these relationships. Okay, so this video, which is homemade and edited by myself, so apologies for any little hiccups. is to help understand adolescent brain development and how that links in with some of those transactional analysis stages. Adolescent Brain by Dr. Roberta Evans. Adolescence is a time full of emotions. Taking risks is natural. It has a lot to do with brain development. 4 areas in particular: amygdala, thalamus, hippocampus, frontal cortex. Think of the brain like an office building. At the front is security. Then you have reception with their filing cabinet, and at the top is the manager. In this analogy, the frontal cortex is like a manager. It is in charge of planning and decision making, empathy and insight. The frontal cortex is covered in a fatty substance during adolescence and is dulled down or switched off. So teenagers are more likely to act without thinking and be self-absorbed. The amygdala is like a bodyguard. We have 2. During adolescence, they are pumped up. The amygdala is responsible for feelings like disgust, sadness, and anger, plus lots of other emotions. The amygdala is in charge of triggering fight, flight, and fright. During adolescence, these are more pronounced. Young people are more likely to fight back, to run away from things, and to have increased stress and anxiety. To quieten the amygdala, it needs a sense of purpose and non-emotional tasks. The thalamus is like a reception desk, relaying messages to the manager and to security. It works with the hippocampus filing cabinet, storing and sorting memories. The thalamus is also dulled down in adolescence, so teenagers struggle with reading social cues, remembering. So all teenagers take risks and push limits. But trauma, abuse, neglect and loss will have an impact, making everything more intense. This can look like hypervigilance, ready for a fight, avoidance, sometimes not seeing the risks. This is because the memories in the hippocampus are complex, often jumbled, with the most hurtful on the edge, ready to tell the amygdala to act or protect. So what steps can you take when working with someone with childhood trauma? Just like a baby needs to know their needs will be met, a young person needs to know they can trust you. Keep promises, be there, listen. Relationship-based practice is essential. Think of this acronym, CPR. Consistency, persistence, reliability. Just like a baby needs a safe space to explore, young people need activities and safe places to explore risks. Physical and tactile activities can calm the amygdala. Think of this acronym: PACE, playfulness,
acceptance, curiosity, and empathy. Just like a toddler needs a sense of personal control, a young person needs to think for themselves. Be able to say no, push back, and test limits. It's much easier to talk and think for someone else after the first two steps have been achieved. 1. Show that you want to work with them. 2. Give space to be active, move around, explore. Avoid an interview room.
Then give choices with some boundaries. Just like a child needs a sense of purpose, a young person also needs to understand themselves within the world. Not having a sense of purpose can result in guilt. Guilt and shame can trigger the amygdala. Explain the purpose of any tasks or activities. Find their personal motivation. Non-judgmental acceptance is key. Just like a child needs a sense of competence, a young person needs to know it's okay to make mistakes. Learning from mistakes increases resilience. Say things like, trust your instincts. Find ways that work for you. You can think for yourself and get help. We can learn together. Then, after all that, a young person can move on, knowing it's okay to grow up. Provide opportunities for new, challenging experiences. Encourage independence. Provide systems for time management and task management. Say, I trust you to ask for support when you need it. So hopefully that video was a helpful analogy of what the brain is like, with the security guard being on alert. That's the amygdala, and it's heightened during adolescence. And where there's trauma and neglect and abuse, it's even more heightened in order to protect. So the behavior will be serving a purpose to protect the child from risks, or to actually help them not have to actually deal with the risk because it's far too painful. And hopefully you could see the link between some of those stages of the emotional development and how that links to our practice in forming a relationship and having that trust, listening to the young person, spending time with them, to the point that we're helping them with time management and life skills. So I'm just trying to figure out, sorry, here we go. I'm just going to present. So there we go, that's better. So just to say that trauma-informed practice means that it's about our approach. It doesn't mean that you need to know the details of the trauma. And this is something really important to understand, because it's the behavior that will be the indicator of the trauma. If you're seeing the behaviors of a little toddler, the tantrums and the pushing back, or the behaviors of even someone who doesn't trust anybody, that's a little baby, then that's telling us that there's a relationship need and there's an emotional need. And therefore, we don't need to know the details of the trauma or experiences that they've had. We can see that there's probably been loss, betrayal, and rejection. And asking direct questions could probably re-trigger the amygdala and just get back into that fighting or just not wanting to listen. So focus on your behavior and your approach with that young person, and keep those promises, and be ready to listen and show care, and take them out and about. Don't bring them into an interview room. Take them out and about and explore. Go for a walk in the park, and I know a lot of you do this already. And see the value in that. It's not a soft approach. It's actually a really important approach when building that relationship, and also giving them that safety. And give yourself 5 minutes to prepare before any interaction with a young person. Just sort of take yourself back into yourself and just think about where in that emotional development is that young person. Are they in a place to be thinking about their future and thinking about their purpose in life? Or are they still in a place where they don't actually trust anybody and need to build that trust first? And if they're in a place of thinking about their future, then do allow opportunities to develop their interests and future aspirations. So hook into that idea of competence and learning to make mistakes with some fun activities, and that can then lead into education and future and thinking about themselves as an adult. And if they're engaging in that, then they're much more in a natural adolescent place of emotional development. And also, because you would have got to that point of trust, and they feel safe, and they feel like they've got a choice, and they feel like they're being listened to, and they've got a sense of purpose, do be prepared for a disclosure. There may well be a disclosure of the trauma that I've just told you to ignore, but be prepared for it and allow them to bring it to you if they need to. And if that happens, you have really hit a milestone mark, and that they are now really thinking about themselves and their future. And be open, accepting, and remain calm, and allow the young person to direct where the support is needed. Because if they're in that place, they really are now starting to think about themselves and their future. There may also be a lot of regret and a lot of anger. And again, go back to the relationship-based approach and having that space for them, giving them space to explore and feel safe. And maybe they'll be willing to also look at some support around that. And just finally, if there's a lot of people involved with a young person, and for some of our most traumatized young people, there will be a lot of people involved because they're presenting with a lot of need, work out who is managing the risk, who's focusing on the engagement and the activities and the access to opportunities. And there could be multiple people, but if there are, be very clear on your purpose. The young person needs to know why you're involved. Any one of us would. If we had a medical condition and we were seeing a GP and a hospital and someone specialist within the hospital, they all have their own purpose. If we had the GP trying to do the job of a surgeon, it would feel incredibly confusing. And likewise, if we had a surgeon then just having a check-in that a GP would do. Although they all do an important job, be clear on the purpose and how that meets the child's needs, and how we're getting them from a place of no trust to some form of choice, to some insight into their purpose in life and how they relate to others. And finally, this is a direct quote from Hanson and Holmes. Highly recommend their publication, which is called That Difficult Age, and there's a link here, but you can Google it, Hanson and Holmes, That Difficult Age, and it's available for free because it was sponsored by the Association of Directors for Children's Services. And they say that we also need to see adolescence as a window of opportunity. And that's because the adolescent brain goes through a rapid process of developing new neural connections, and this process is fundamentally shaped by social interactions and relationships, thus contributing to this life stage as one that offers a significant window of opportunity. So always have hope. This is a lot of change going on for a young person, and your relationship could make a huge difference. And these are the resources. There's a website there for the teenage brain on Women's Hour, but literally if you Google that, you should be able to find it. And I hope that's been helpful. And you can use it in your team meetings or workshops. Thank you.